My name is Maryl Johnson. I'm a transplant cardiologist from the University of Wisconsin. My presentation today was on the topic of antibody-mediated rejection. The reason this topic was that I chose this topic is because we've done very well with improving outcomes in patients following heart transplantation in terms of their cellular rejection and less infection and so forth, but we still have compromised outcomes long term. One of the main reasons for that likely is antibody-mediated rejection. This is truly a challenging field because the definitions have not been well agreed upon. I think the pathologists have finally gotten their act together and now have some definitions for both pathology as well as immunopathology to define antibody-mediated rejection. But we as clinicians need to define if it's just a pathological diagnosis or if we need a clinical syndrome to go along with it. And then we're also interacting with our histocompatibility colleagues with a better definition of donor-specific as well as other antibodies that may be related to this field. I think the challenge of the whole field of antibody-mediated rejection is that we know that patients that have this after transplant, whatever the definition, is that they do more poorly long-term, both in terms of survival as well as in developing allograft coronary artery disease. Because of that, we really need to think about different treatment modalities, different preventive modalities that will likely require long-term outcome studies from individual centers, multiple centers, as well as possibly registry data to help us define this field better, as well as move the field forward in terms of preventive and treatment strategies.